The Red Barn provides equine assisted services to low income individuals with disabilities and special circumstances. I have had the great privilege to volunteer for her organization for what I believe is going on 7 years, of course, pre COVID. She has an amazing program and an incredible staff. And the Red Barn is like one of the most beautiful places in Alabama. And as a volunteer, I always feel an immense sense of peace and tranquility when I'm there. And of course, then, working with the individuals and the horses and her staff is so rewarding. But over the years, Joy and I have also had some opportunities to collaborate professionally, which I've found to be really powerful because I can't think of anything more healing than combining nature and therapeutic animals, the arts, and of course, compassionate people. Never has there been a more fitting name for someone, as she truly brings joy to those in her presence. She has the heart of both a servant and a healer, and I'm honored to know her. And I will turn it now over to Joy O'Neill. Welcome.
Well, thank you, Kimberly. I hope I can live up to that. Thank you. So, on all the personality tests and things that you do, I am an introvert. So, like, I'm so much so that even Star Trek is my favorite TV show. But public speaking has always been difficult for me. And now, though, I've discovered something that's even scarier, and that's doing this on Zoom, so that I have this fear that my face is going to freeze up in this like sort of way. Everybody will look at it. So it feels kind of scary, at least to me, to be on this side of the computer. I don't have Kimberly's poise and grace on camera. And I even thought about trying to back out of doing this, but because I just feel so awkward. But I knew that even as awkward as I feel, that it would be worth it if somebody can learn from my story and not have to go through what I did. So 2013 was kind of the last year that I remember feeling normal. In 2014, I told my doctor that I was short of breath, hot all the time, and gaining weight. My doctor told me I was just premenopausal and that I should only expect that things would get worse. In 2015, I was told that I should just take it easy. It made me feel like it was all in my head. And I sought other opinions and was told that I had everything from allergies to depression to anxiety to prediabetes. In 2016, I still wasn't feeling better. And I was told things like exercise more, eat a Mediterranean diet, which includes things like feta cheese and olives, and all those things are high sodium, which was about the last thing I should have been eating. To wash my hands more so that I'd stop getting all these respiratory infections, to take allergy medicines, to eat fewer carbs so I would stop gaining weight, drink a glass of wine to relax every night, which I didn't really mind that much, get a hobby so I'd have something to do, learn to delegate, and just to stop obsessing about my health. This is just a natural thing. Women just change over time. But no matter what I did, I just kept feeling worse and worse. And you can see just in like 3 years, there was a pretty dramatic transformation in my appearance. And so I was crabby all the time from being exhausted. And I was gaining weight, even though I was eating just next to nothing. So that then I was hangry. And you know how like afterwards you go and you say something to people like, I was so crabby, and you expect them to go, oh no, you weren't. Nobody said that to me because I was really crabby and just me, it was just awful. I was just, and actually, no joke, I even started wearing maternity jeans because by the end of the day, my pants wouldn't button. I had to unbutton them and like do the whole like rubber band over to connect them. So I bought a pair of maternity jeans because that's all that I could wear. And so in 2016, I had a physical when I was purchasing a life insurance policy as part of succession planning for the Red Barn. And it was in that life insurance policy purchase that I had my first EKG that was given by a technician in an office building downtown. I'll always remember opening the letter from the insurance company telling me that my rate would be increased due to my EKG. So when I opened up this letter, I was madder than a wet hen because I thought that they were just trying to jack up the price. I mean, for 2 years, I had been going to doctors and had been told that I was perfectly healthy. There was nothing wrong with me. I talked to the insurance company and they said that they would reinstate the lower rate if I went to a cardiologist and had another EKG that showed that everything was fine. So I went to a cardiologist and he performed a bunch of different tests and told me that I had heart failure due to an electrical problem in my heart. I was shocked at first, but then also a little relieved because I knew then that it wasn't just all in my head. One of my best friends encouraged me to see a doctor specializing in women's cardiac health, but I didn't even know what to do or how to go about doing that. And just by chance, Kimberly was volunteering at the barn that day. And so I asked her for a recommendation, and she told me about Dr. Pambukian at UAB's brand new women's heart clinic. So Dr. Pambukian confirmed the diagnosis and told me that if I had been a man, I would have likely been taken to the emergency room as soon as I first began complaining of my symptoms. So I want you to think about this for a second. Can you imagine a man going into a doctor and saying, I'm hot all the time, my heart is racing, I can't sleep, all of these things are happening, I'm swollen up by the end of the day, and that doctor would have said, oh, just go hang out with some of your guy friends and see if you can feel a little better. Like that just wouldn't have happened. So Dr. Pambukian began an aggressive plan because she said I'd already lost 2 years of treatment at least. And it's really scary when you do a web search about heart failure because you see that about half of the people die within 5 years of receiving their diagnosis. And Dr. Pambukian assured me that we could beat those odds with proper treatment and if I followed her orders, which I do because I want to live, and also I'm a little bit afraid of her. She is quite the intimidating person. But even on my deathbed, I'll always wonder, like, could I have lived a few more years if I had just gotten treatment sooner? So I've since learned that my heart failure is most likely caused from risk factors from genetics on my birth father's side. I never met him. He left when I was very young. We never saw or heard from him again. And so this made it even harder to share my diagnosis with family because it wasn't just a diagnosis for me. It was also a potential diagnosis for my siblings and my children as well. 2 of my younger sisters have now also found out about their own heart disease, and our children know that they should be vigilant about their own health. My healthcare insurance was excellent, so that's not why my diagnosis was missed for so long. It was missed because my doctor didn't think to check my heart because I don't have high cholesterol or high blood pressure. And I didn't know enough about women's heart disease to insist that my heart be checked. So I want you to learn from my experience because no woman should have to go through what I did and be misdiagnosed for so many years. I want you to know that heart disease is the #1 killer of women. Only about half of women know that fact. 1 in 3 women will develop heart disease in our lifetime. And if you're African American or Hispanic, those odds are even higher. I also want you to know that women are underrepresented in research about heart disease. So the chances are your doctor really doesn't know that our symptoms can be different than a man's. For example, women make up about half of all the people in the United States with heart failure, but only 25% of research study participants are women. Doctors often may not realize that a woman's symptoms of a heart attack are more subtle and harder to detect. The classical symptoms of chest pain and pain in the left arm can happen for men and women, but women also can have other symptoms like difficulty breathing, persistent nausea, abdominal pain, lightheadedness, and tiredness. So unfortunately, you are probably going to have to educate your doctor and insist that your heart be checked. I want you to know that a simple blood test and other non-invasive tests can be used to diagnose heart disease. Before my diagnosis, I'd had several CT scans to see why my abdomen was so swollen. I was sent to allergy doctors and counselors. They did all sorts of tests to see if I was diabetic or had cancer. I took so many antibiotics due to constantly having bronchitis and pneumonia that I developed C. diff and had to see a gastroenterologist. I am sure that the insurance company spent tens of thousands of dollars on me, maybe even more. But in my case, a simple blood test done as part of a routine physical could have detected a protein in my blood indicating heart failure. And that $100 EKG given by an insurance company employee in an office building saved my life. And all the time, all these other tests had been ordered and nobody could find it. So I tell every woman to insist your doctor checks your heart as part of your routine physical, even if you don't have symptoms. I'm routinely given mammograms and pap smears, even though there's no history of those cancers in my family. But I was never given a screening test for the one thing that I'm most likely to die from as a woman. And I want to be very clear, you still should get a mammogram and a pap smear. Absolutely. I'm just saying you should also insist that they check your heart. I want you to know that there are things that you can do now to help your heart stay healthy. While my heart failure is most likely genetic, I'm grateful that there are things that I've done in the past and that I can continue to do to make my heart stronger. Those are things like exercise, watching blood pressure and cholesterol, and eating a healthy diet, especially one that's low sodium. Do everything that you can to keep your heart as healthy as possible. One of the best resources that I can recommend is Women Heart. It's the only organization specifically dedicated to educating women about heart disease. It's been almost 5 years since my diagnosis, and I'm feeling good now that I'm properly managing my health. And I absolutely love my team at the Women's Heart Clinic. But still, every time I go in for an appointment, I worry that this might be the day that I get the bad news. My appointments always start out with labs on the second floor. And I just got to say, I loved being able to hear the music at the Kirkland Clinic. They used to have live musicians, whether it's somebody playing a violin or a piano or a flute, just the live music just kind of going up through that atrium. Because it's kind of nervous when you go in. It's like, is today going to be the day? Like, what am I going to find out? What's going to happen? And that music really just helps me to relax and not to be so anxious. But so right now, though, I live in this kind of weird balance between having a chronic, serious diagnosis and not really looking like it. So when I visit other doctors, like a while back, I saw a dermatologist because the medication I'm on gives me really dry skin. He didn't believe me when I said that I had heart failure. He thought that maybe I meant I had a heart attack or that I misunderstood it, because he's like, oh, but you don't look like you have heart failure. And that's just so frustrating. And that sort of ignorance is a constant reminder to me that my delay in diagnosis was due to doctors not understanding and dismissing my symptoms because they just didn't think to check my heart. And so I'll be forever grateful for that simple life insurance exam, because without it, I would have missed so many important things these last few years. Like my daughter winning her first World's Championship, the wedding of my stepdaughter Sarah, the wedding of my son Jared, the birth of my first grandchild, Claire, from our daughter Natalie, and Claire's very first horse show, the birth of my first grandson Jack. And I'm happy to say that in April, I'm going to be a grandma again. My son Jared and his wife Liz are going to have a baby. And so I would have missed or could have missed all those precious moments, all because my doctor didn't think to check my heart. And I'm looking forward to having many more of those precious moments because of the great treatment that I've gotten at UAB. So I want you to please learn from my experience and know the facts about women's heart disease, and to be your own advocate and count your lucky stars that we have such a great women's heart clinic at UAB, and that pretty soon I hope you'll be able to hear music again in the clinic as you wait.
Joy, thank you so much for sharing your story with us. If anyone has any questions, please just type them into the chat and we'll ask them for you. Joy, I have a question to start us off. Would you mind just giving us, like, for instance, I have no idea, what are some of the basics of a heart-healthy diet? You mentioned the Mediterranean diet probably wasn't a good choice, but what is it? What are just some basic, good, heart-healthy foods that you've been eating that have made a difference for you, or cutting certain things out?
Yeah, low sodium is probably a biggie for me at least. I think the American Heart Association says it should be around 2,000 milligrams of sodium a day at the absolute most, and that is like if you just eat out one meal, even at somewhere that you might think might be a healthy meal, you can easily go past that just in one order of takeout. So a lot of fresh vegetables, limited meat, if any meat at all. Nothing really from a can unless it says low sodium or reduced sodium. And you know, that like before when my doctor had told me, he's like, eat the Mediterranean diet. So I'm eating, you know, feta cheese, which is incredibly salty, olives by the handful, like almost two or three olives is pretty much my entire sodium quantities a day. And then I was drinking Gatorade because he said maybe I was gaining weight and becoming swollen because I was dehydrated, and you know, working at the barn, we were outside all the time. So here I am drinking Gator, you know, like a gallon of Gatorade and water a day, eating all these high salt foods, which was the exact worst thing that I could have been doing. So
Kimberly has a question. In addition to nutrition, what other lifestyle changes did you make?
I'd say a more intentional exercise program. So one of the things with what I have, and of course, I mean, every situation is different, but for me, walking is the best thing that I could do. And so before I had, I mean, I felt like I had a pretty healthy exercise routine just because of being so active, walking around the barn, being in lessons, being outside. But it's really like an intentional 30 minutes of walking a day. That was the best thing for me. Other people, you know, it might be weight training. That's not good for me because of the strain that can put on your heart. But just walking 30 minutes, like not just walking. I mean, it's easy for me to get 5 to 10,000 steps a day just walking around the barn, but that's like in 5 minutes here and 5 minutes there, but just an intentional 30 minutes a day.
And then kind of a similar question from Molly. What are some habits in addition to diet that I could pick up to promote heart health?
I hate to sound like a broken record, but it's really just diet and exercise. You know, watching your cholesterol, the amount of salt that you have, eating a low fat diet, lots of fresh fruits and vegetables. For me, one of the biggest differences was all 5 of our kids are out of the house, and so I had really gotten into the habit of just picking up dinner on the go. And I thought I was eating at healthy places. I mean, I wouldn't. There were, what is it called? It's not fast food, but kind of like that next tier. I don't want to name any restaurants because I don't want to make anybody mad. But you know, I mean, it wasn't like fast food hamburgers and fries, but it was other places. But really just having to become disciplined to cook meals at home, because that's the only way that you really know how much salt is in the food, at least for me, and how that fits in.
And then we have a question from Rachel in the chat. Did your abdominal bloating go away with your reduction in salt?
Yes. Like I lost once I received the diagnosis and I was put on Lasix, which is a spironolactone and digoxin. I take like 6 different medicines right now, but I lost like 20 pounds of fluid within just the first week. So it was amazing. Like,
That is astonishing.
yeah, it was it just really surprised me. And I would say even now, like I'm still on a lot of diuretics, and I can tell a big difference if I splurge. And I mean, Dr. Pambukian is great, and she's like, if you're out somewhere and you have everybody else is eating a meal, or you go and just you have to eat, maybe you blow it that one day, just the next day, just be extra vigilant and flush it all out. So,
Then we have another question from Kimberly. What are some of your favorite heart healthy foods or meals?
oh, I guess I have really started to like a lot of salads, just because that's so easy to fix. Just to keep the lettuce at home and add some like chopped up vegetables. And I would say during COVID, that was probably one of the healthiest times I think that I've eaten, because I didn't have the choice of going out to eat, especially in those first few weeks. So just, a lot of salads, a lot of fresh fish and shrimp, and just grills, just simple. No soy sauce marinades or anything like that, but just simple foods.
Then from Brianna in the chat, did you have high cholesterol?
I did not. My cholesterol it wasn't ever low. It was still within normal, but it was always in the high end of normal, but it was never considered high, like over that mark.
And then Joy, I have a question for you. What are some ways that you've learned to advocate for yourself in the doctor's office or in the medical field? Because I know I personally struggle with that. The doctors are the authority figures. What are some like tips or tricks, or what have you learned on how to advocate for yourself in that setting?
That was really hard for me as well. And I think, when I went back before, and I don't think that the doctor that missed it, like, I don't think he was a bad person. And, and he kept trying to find something. He sent me to all those other doctors and kept, like he exhausted a lot of other options. But so I think it just came down to finally just knowing myself and knowing women often are misdiagnosed with heart disease. And so just knowing it and being able to argue back. And I am the only of my mother is a nurse, and all of my sisters are nurses. So I'm the only non-nurse in our group. And it was hard for me to argue with a doctor. And I guess after going through what I've done, I've just gotten over that. Just being able to say, like, hey, I know you know a lot, but this isn't right. Like, you have to trust me. And yeah, I know. And like the dermatologist I went to, he's like, I mean, this is sort of very insulting. He said, oh, well, like, how did you get that? And I said, well, it was genetic. And he said, oh, I've never heard of that. That just can't possibly be true. And I said, well, it is true. And I'm participating in a genetic study that UAB is doing. And, it's absolutely true. And so I just went back home and went online, found the link, sent it to his office, and just said, this is it. Like, I know for a fact this is true. Like,
I'm so glad that you stood up for yourself and sent the link.
yeah, I mean, like there are a lot of things I don't know, but one thing I do know is my own diagnosis, and that it's there. Like, that women, 1 in 3 women will get heart disease, and it is the #1 killer of women. And the fact that he doesn't know it doesn't mean that it's not true. It just means that he didn't learn it.
Oh, we have
Yeah,
another
but now he
question.
knows.
Now he definitely knows.
Now he knows. Yeah.
We have another question in the chat. Do you have a sense whether awareness is improving in the medical field regarding heart disease in women?
The doctors that I see, I would say it's improving. So, like, I think there's a lot, Women Heart, like I said, it's a great organization and they're really doing a lot to try to help get the word out. And I think events like this where women can learn, and I was able to go right before COVID last fall, was able to go speak at to a group of doctors in Philadelphia at a convention that Women Heart put on, and as well as one in New York, to just really try to get the word out about heart failure in women. And that was a great experience, and I was really looking forward to spending most of 2020 being able to go around and do that and share my story with like a lot of emergency room doctors when women come in. COVID kind of put a stop to that campaign, but hopefully soon we'll be able to do it again.
That's wonderful. And what has kind of motivated you to, even though you are an introvert, to share your story so much? Because it sounds like, in addition to this, you've given talks over other places and we're planning on it. You're not the only woman diagnosed with heart disease. What really struck with you and made and convinced you to share your story?
The unfairness of it. I mean, for 2 years, I just felt so it was like being in a fog. I mean, I was gaining weight. I was too tired. Like, I didn't go anywhere. I'd lost track with all of my friends. Like, I was so tired. Everything in my life just changed. I was cranky. I was mean. I was, easily agitated. Um, I was so mad, and I'm still mad. Like, I think, what if this happened, or what if I had died? All those what ifs. What if I had not been able to go to my son's wedding because I had died? What if, just all like, what if, all the people that, I don't know, it just makes me furious, and I just want people to know so that they don't have to go through that. And I want doctors to know as well. So even though I'd rather just be, sitting on my couch watching Star Trek reruns, I'll go out and do it because I think it's important enough if it helps somebody else.
Well, I am certainly grateful for your righteous anger, Joy, because I know it's not a topic I had thought about. And I talked to my parents and learned that I have heart disease in my family, which I didn't know about. So you've already made a difference, at least for one person.
Well, good. Thank you. I think everything happens for a reason, right? Everything that we've all been through, like, that can be redeemed and made better if it helps somebody else. So
absolutely. We have some more questions in the chat.
One is, not to cry anymore.
You are absolutely allowed to. Are symptoms of heart failure generally the same, or do they manifest differently with each woman?
So I'm not a doctor, or a dietitian. So I was like, oh gosh, I hope I'm giving good advice on all these things. But I think that there are some common symptoms, like the swelling. One of the things, in heart disease is a lot of times the swelling can happen in your legs and your hands. And in women, the swelling can often happen in our abdomen, which is why I looked like I was, 6 months pregnant, wearing maternity pants by the end of the day. Unexplained weight gain, being short of breath. Like, I couldn't walk up the stairs to without having to stop and take a break. I being short of breath, coughing constantly. Like I had bronchitis and pneumonia and colds. There was just so much fluid in my lungs that just all those little things kind of adding up. Being exhausted, just like really, really tired, are all pretty common symptoms. But each person is different. At one of the conferences that I went to before, there was somebody who, before her diagnosis, she had been a marathon runner and she had always had really great times. And she had heart failure. Well, as she developed heart failure, she noticed that her times running a marathon were getting longer and longer. It was taking her longer to run. And so she was still able to run a marathon, even though she had heart failure. It was just adding 5 or 6 minutes to her time. And I couldn't run a marathon even at my best of health. But it differs from person to person. And I think the thing is, you have to know your own body.
Okay, we have another question in the chat from Tamisha. I always assumed breast cancer was the #1 killer among women, especially Black women, so I learned something new today. Why do you think this isn't something that's more talked about in terms of awareness for women's health?
I don't know, other than marketing and advertising, or just, I don't know. But Women Heart has some great resources, and they do a really great job of trying to change that perception.
Thank you, Joy. Do we have any more questions? Here's one. Do you know what age heart failure is generally caught in women? I'd be willing to say it's never too soon to get tests done, especially if there's a family history of heart attacks.
I don't know. Again, I'm sorry, I don't know the answer to that one, but I know that it's never too early to insist that the doctor check your heart. And for me, even though I'd had children, I had a couple of surgeries, if I had like a baseline EKG, where they could have gone back and checked that, like you have a baseline of other tests, and then years later you're able to go back and see it. Once I got my diagnosis, I was calling back saying, okay, well, when I was in the hospital having my kids, did they do an EKG? Like, was that a symptom that they saw there? Or when did this change happen? How long had this been going on? So I just say, insist that they give you a checkup. I mean, it's like while they're ordering your blood work to do a CBC, it's just one more little thing that they do with a vial of blood. Like, it's next to nothing. It's so simple. And an EKG can be given by a technician in an office building. It's so simple to do. There's really not any reason that it can't be done.
We have another question. Did you have to address stress in your life as part of this process, or did you already do a good job managing stress?
I think the most stress that went away is when I found out that there was really something wrong with me, that it wasn't just all in my head. Thinking that knowing that you feel bad and that you are exhausted and tired and gaining weight. At one point, my doctor's like, well, I know you probably think you're eating healthy, but you're probably cheating and eating cookies at night and things that you don't realize. I'm like, no, I promise I'm really not. I am a rule follower. I will, I am not accidentally eating cookies at night before I go to bed. It's almost like being in one of those weird Twilight Zone movies where they're making you feel like moving the cup from one side of the table, when you get up or something. It was really bizarre. It was very stressful to think that there's nothing wrong with you, and that you can't climb out of this fog yourself, or that you can't fix it, or that you can't get over it, and that you're not fibbing about what you're doing or where the things are. So that was that was the biggest stress relief, is to find out that there actually was something wrong. But then I think I do a pretty good job of managing stress just on a day-to-day basis. But
Do you have any tips or tricks? Like, do you meditate or do you delegate? How do you manage your stress?
well, I think I'm a Christian, and so I think prayer and believing that God has a plan whenever things get overwhelming, to just kind of go back and think about, like, God has a plan for my life. God is directing the steps. I can get through this. To me, that is the biggest stress help. We have a great team, and I have a fabulous family. And so I think having wonderful friends and coworkers and family to help you manage stress and to keep everything in the right perspective of, in 5 years from now, is this going to matter? In 10 years from now, is this going to matter? Um, I, I don't know. I guess that's it. I would say that definitely my perspective on what's really important in life changed with the diagnosis, because I'm much more likely now to, stop and take a few minutes to enjoy things, to smell. It sounds kind of cliche, but that's really true.
Thank you, Joy. We have another question from Brianna. In what ways should the doctor check your heart at your yearly physical? Should an EKG be requested? Are there other tests that should be requested?
Like I said, I'm not a doctor, so I can't say. I just know that there are, like, it's called a BNP test, that can show you if you have a protein that indicates heart failure. An EKG is one way. I just think that you just talk to your doctor, and you can go on that Women Heart website, and they have all sorts of downloads. And I would just download those materials, take them in, and say, I know that heart disease is the #1 killer of women, and maybe I do, maybe I don't have symptoms. Like, I don't know what your circumstance is, but just knowing that and asking them over and over and over. And I really think that most doctors would be able to, like, if you insisted enough, they would do it just to get you to be quiet, right? I mean, like, just be persistent.
We have another question, and I think this is in reference to helping with your heart disease. What is the importance of sleep?
Oh gosh, sleep is incredibly important. And not only just for heart disease, but for anything in your life. And I think there's all sorts of research that shows that a good night's sleep, like when you talk about stress, if you get a good night's sleep, everything really looks better in the morning. Sleep is when your brain kind of resets. Like, the idea that if you work, all nighters, that you'll be able to do a better job really isn't true. If you need your brain to be reset and ready to go the next day. Sleep is incredibly important. And, one of the things, it's not what caused my heart disease, but sleep apnea can also cause heart disease because of the stress that puts on your body, not being rested enough.
Thank you, Joy. We have another question. What diagnoses did you have that were wrong?
Well, I never really got another diagnosis. I guess it was just more of being misdiagnosed. Like, I didn't have diabetes. I didn't have cancer. I didn't have a mental health disorder. I didn't have, like they never actually gave me another diagnosis. They just never found the right diagnosis, if that makes sense. So I guess I think my favorite one was, a doctor told me, my youngest son had just moved away to college. And so when I was talking to this doctor, he said, oh, I see this all the time in women. Their children have moved away, and they're suddenly without, like, a purpose in their life. I mean, it was so condescending. I just, like, you just need to find yourself. It's all right. This is really common. It's, you just, like, get a hobby or do something. It just, And now I like, oh, that just makes me so mad. Like it was the fact that my son had moved away was making me sad. I was like that was my reason. He's like, oh yeah, it's really common in women when they have an empty nest. But like, oh my god! So I did send that doctor a letter. I did, and it wasn't a nice one. I was still cranky then. I was like, that was not it. You were wrong. You were so wrong. It wasn't just that I was this lonely housewife, looking for something to do.
Yeah, I don't think many men get diagnosed with empty nest syndrome when they actually have heart disease.
Yeah.
We have a lot of very passionate replies in the chat.
No, but it's true. Like that really happened to me. It's it's so infuriating.
Joy, one thing that I found really interesting when talking with you is, your work at the Red Barn, you're so passionate about it. Did your diagnosis ever affect the work that you could do there? Because it seems like you just like kept working even though you felt like so terrible, and you kept, doing your passion. Did you ever have to take any time off?
Yeah. And I may cry again when I answer this. So the we started the barn in 2012. And so, 2014, 15, and any time that you begin something that you're very passionate about, like a nonprofit, you work really hard, right? Like you love it. I love kids. I love horses. So we're working, and, at first they're like, well, you've got to delegate, and which is true, right? So, I mean, you have to delegate. So like I'm delegating things, and the doctors are telling me there's nothing wrong with you. And then I go to the barn and I see like kids that have CP or are in wheelchairs, or they have just incredibly difficult lives because of their diagnosis. And so the whole time I'm thinking, there's nothing wrong with you. Get up and do something. Like, there's nothing wrong with you. Look at all these other kids and how hard their lives are and what you're doing. And I would say that was the reason that I would get up every day. And we see about 75 kids a week, and we have a huge waiting list. And so I kept a list of the kids that are on our waiting list on my bedside table. And every morning I would wake up and I would be so tired. And I would just say, I've got to get up, look at all of these kids that really do have something wrong with them. There's nothing wrong with you. Quit your whining. All of that self-talk, I think that women, like, we give ourselves, like, there's nothing wrong with you. Just get up, just keep going, just let it, push on through. And I think that they motivated me so much, and gave me a reason to just like keep up and keep going. But I would say I was cranky. Like, that's the only thing I can say about it is, I love the barn and I've always wanted it to be great. And I do tend to be, like a perfectionist, and, always wanting things to be good. And so, I put probably a lot of pressure on people just because I wasn't at my best.
Thank you, Joy, and for your dedication to the Red Barn, because it is such an amazing place. Do we have any more questions? We'll wait a minute or two to see if anyone drops any more questions in the chat.
And if there are any nonprofit, I always try to look for the silver lining in things. And I would say one of the silver linings in that is, because of how I felt, I really did have to delegate. And even though I might have been like, cranky, I would say anytime that you found an organization, that you always want to make sure that it can run without you. And, Kimberly just said she never saw me cranky. That's because when volunteers were there, I had to be on my best behavior. It's like, if you talk to other employees, they will probably tell you differently. But one of the silver linings is that it really did force me to learn to delegate and to pass things off. And I would say, especially like after I got my diagnosis, and especially like maybe 6 months before the diagnosis, and then right after it, I was going to the barn very little, maybe just once or twice a week. I wasn't doing a whole lot. And so, if there is any silver lining in it, it's that um, just that whole succession plan of what every founder of an organization needs to do kind of came up. And I think, as sometimes if I talk to other nonprofits, I always talk about the importance of succession planning, because that's the whole reason that I went and got the life insurance exam, is because I volunteer my time as the executive director. And so we were talking about, well, what would happen if I was in a car wreck, or if something happened, like all the people I was cranky to pushed me off a bridge or something. So, thinking about the succession plan of that, that's really important. And I think that's one of the best things that came out of it.
Okay, we have one last question from Tracy. What exactly would you have done differently when you first showed symptoms if you knew then what you know now?
I would have just insisted that they take me seriously. And just insisted that they took me seriously and that they tested it. They could have found out years before just with that. And even if something, like, I always wonder, like, at what point did it become heart failure? Because, like, for me, the problem is there's an electrical blockage in my heart. So, like, is it something that just kind of, like, if they had done, say, an EKG every 6 months or once a year, would they have been able to go back and look at that and see, oh, this is changing, this electrical circuit is not working, or like what would it have looked like? So I would have just insisted that they check my heart first. And if they'd done that, I probably could have avoided all those other tests.
Well, Joy, thank you so much for sharing your story with us today. I think we've all learned a lot. We have some comments in the chat thanking you for sharing your story. So we just really appreciate it. And we're so glad that you got your diagnosis and are living your full life again.
Well, thank you. And thank y'all for giving me the chance to share it with everybody, and for making it as it wasn't a painful experience at all. So thank you very much.
Good. That's what we like to hear.
Okay. I wish I had y'all's poise, like both you and Kimberly, as you're able to say things. So,
well, you seem like a Zoom pro. So
I don't know about that, but thank you.
Thank you, everyone, for coming. Have a great rest of your day.